yours truly, Professor and Dr. Dalton Gilpin, continuing in the field of oncology, and we're on cancer of the vagina and cervix, and we have just described vaginal cancer, cervical cancer, signs and symptoms, and endometrial carcinoma. And we note here a statistic that 1 in every 4 person with endometrial cancer has cancer of the rectum after treatment, or has spread outside the uterus, which is advanced cancer. That's a little statistics there. 1 in 4 person with endometrial carcinoma, endometriosis, cancer that has returned rather after treatment. Cancer has returned after treatment, so that's not rectum. Return is a word. After treatment, or as spread outside the uterus, which is now an advanced stage of cancer. And here we also have now a little modern treatment of Gem Pearly, which is an immunotherapy designed to work with the body immune system. To fight the cancer. All right, so we will not write that, but just make a note of it, a verbal note of the statistics and the advanced stage of cancer and the Gem Pearly immunotherapy. All right. Okay, let's just briefly mention here cancer of the lungs. And for this, we specifically want to make a note of this mesothelioma, and that has been going around this cancer of the lungs thing. We note about that military thing, and they have sent me paper to sign up there, but I was in the military in that asbestos sort of a causing infection of the lung cancer. But let's see what I have here on lung cancer, mesothelioma. That's blood cancer. We have done lung cancer, or just this one for the moment, meso. And there is much to be said about those soldiers that were exposed to certain probably asbestos-like chemical and other substances that would have caused lung cancer. And there was a lot of lawsuit going out for this exposure, and those soldiers that were exposed to the asbestos-like substance that would have caused lung cancer or mesothelioma. Let's also briefly mention here, colon cancer. Also called CRC, which is colorectal cancer. Also known as bowel cancer. Or rectal cancer. And these cancer develop from the colon or rectum, which is part of the large intestine. Which is part of the large intestine. Also, I've got gastrointestinal cancer. Which relate to the malignant condition of the GI or gastrointestinal tract. Related now to the malignant condition in the GI, which is gastrointestinal tract. So we just briefly gone over your lung cancer, very specific type of lung cancer there. And we have colon cancer, bowel cancer, rectal cancer, and then we have gastrointestinal cancer. All right, so let's move on now to liver cancer. And pancreas or gallbladder cancers. These are now hepatocellular carcinoma, HEPATOCELL, hepatocellular carcinoma, or HCC, hepatocellular carcinoma. And this is the most common form of liver cancer, and of course most often in men than in women. So we're saying, men could just make a note of that these liver cancer occur mostly in men relative to women. And in most cases, the cause of the cancer is long-term. Damage of the liver or cirrhosis. So cirrhosis, damage of the liver, is usually the cause. And that now, people with hepatitis B and C are at risk to liver cancer. So we put hepatitis, hepatitis B and C. You have hepatitis A, B, C, D, and even E. And hepatitis B and C are mostly subjected to the liver cancer. Cause of liver cancer. Well, all right, for this now, if the cancer of the liver now, if the cancer originates in the liver, if the cancer originate in the liver, then this would be a primary liver cancer. However, if the cancer starts somewhere else in the body and then metastasis to the liver or move to the liver, then that's like a secondary liver cancer. Cancer starts in other part of the body, and then move to the liver. Move or metastasis to liver. And my page is coming to an end here. And you could just put here for this page here that we have taste, certain treatment of this liver cancer, which is transarterial, I think it's chemo, and then we have CP, which is it's just a special treatment that just drop in here for certain cancer that is probably inoperable. And what happened, you could use a precise instrument here and the CP would be chemo immuno precision injection, something like that. Precision injection, which the cancer treating chemical is placed in some form of a precise tube and to the area of the cancer or the liver tumor, and then the injection is made. A precision injection is made. Oh, this other one is a TACE, which is a transarterial chemoembolization, something like that. We will see exactly the precise expansion of this meaning of TACE and CPIP. But these are sometimes used when the tumor is inoperable. And you could just use this form of therapy to diminish the effect of the cancer or the tumor, the TACE and the CPIP. So there we have it for the night. We have concluded on certain topic in oncology and cancer. Brief overlay, and there's much more to be said and much more to be done with this field of oncology.